Well, there's a lot changing today in the U.S. fight against the deadly Ebola virus. A second patient in Dallas being moved after questions about treatment in the hospital there. And here in Bangor, there's a task force in place to ensure that doesn't happen here.
News Center's Katie Bavoso attended one of their meetings today and joins us now with more.
And now, Katie, what exactly is this task force and who is it made up of?
Well, Chris, this is an infectious disease task force that's been meeting since August, and it's actually made up of local and state health and government organizations, including the Maine CDC, EMHS, Bangor International Airport, Border Patrol, and many more. The point of the task force is to have an immediate and fluid response to a biological threat like Ebola should the virus ever come into the community. The task force has been meeting monthly since the plane carrying the first Ebola patient stopped in BIA for refueling. But since the cases of Ebola in the U.S. have increased, these meetings have become more frequent. Bangor's International Airport, like I say, is an international one, and although the possibility of a person infected with Ebola coming in through BIA is unlikely, there is still a chance it could happen. It's just one of the scenarios the task force wants to be ready for in order to contain the virus and keep it from spreading.
We just want to make sure on a local level that we are prepared as possible, and again to mitigate the risk as much as possible. All these organizations, we all have our separate emergency plans, and again what we want to do is coordinate all of those plans, improve the communication, improve the response.
It's not just a single individual or single organization that is going to be able to appropriately respond to this. We need everyone responding as a coordinated unit.
Emergency rooms in hospitals in Bangor are also taking precautions by asking the people that come in questions about their symptoms and where they've recently traveled to. And this is to determine, Sam and Chris, if the person is able to be exposed to the rest of the crowd in the emergency room, or if they could possibly have Ebola, if they need to isolate them so as not to expose healthy people.
So one of the questions, Katie, is what would, if someone who could possibly have Ebola comes into one of our local hospitals, how do they handle that? What's the procedure?
Well, Sam, according to the director of the Northeastern Maine Regional Resource Center, the hospital staff are equipped to be able to safely contain the patient so as not to risk exposure to other patients and spread the virus. And at that point, a team from the CDC would come in and arrange to more than likely move the infected patient to a specialized hospital in the country where they are going to treat Ebola more efficiently.
Okay, a lot of good information there. Thank you very much for that, Katie.
All right, thank you for that report.